Hi everyone and welcome to our module on the venous drainage of the upper limb. Now venous blood in the upper limb tends to be drained by two sets of veins. The first be the superficial veins. Superficial veins are veins that we tend to find within the skin. And then we have the deep veins. Deep veins are veins that are found beneath the skin, usually within the muscle compartment. Starting off with the superficial veins. Now in this image, we could clearly see a number of veins just underneath the skin. And these veins are regarded as superficial veins. They are more prominent in muscular individuals compared to people that have a large amount of fat within their upper limb. The major superficial veins of the upper limb that you should know includes the cephalic vein, the basilic vein, the median cubital vein, and the median vein of the forearm. Amongst these four major superficial veins, the two that are extremely crucial for you to know in terms of your incus would be the cephalic vein and the basilic vein. I will be starting with those two next. Just a brief introduction to superficial veins. Like as I said before, superficial veins are veins that are found within the skin, so they are located at the subcutaneous portion of the skin. These are veins that tend to be connected to each other and they tend to eventually terminate into deep veins. So it's important to note that while superficial veins are found within the skin and deep veins are found within the muscle compartments, the superficial veins would eventually drain into the deep veins. Before they terminate into the deep veins, superficial veins are also connected through um, what we call perforating veins throughout their course. So as we talk about different superficial veins, cephalic vein, basilic vein, and the others, it's important to note that as they are running towards their point of termination, they tend to have a bit of communication with the deep veins, and this communication is made possible by what we call perforating veins. One extra point to note about the superficial veins is the fact that they contain valves. They are usually veins with valves. The reason why a vein would have a valve is because of this would ensure that the vein has what we call a unidirectional flow. So veins are meant to pump blood towards the heart, and that's usually going to be a form of um, blood movement that is against gravity, that is against gravity. So as a result, they need to be able to pump blood in a way in which blood is only going towards the heart and not going down towards the distal portion or where the veins are coming from. So in the case of superficial veins, alongside deep veins, we have valves within them, and these valves are present there to ensure unidirectional blood flow towards the heart. What are the superficial veins that you need to know about? Starting with the superficial veins of the hand, this is known as the dorsal venous network. Then from the veins of the hand, we have the two major veins that originate from the dorsal venous network and would take the entire course of the superficial veins of the upper limb. And these are the cephalic vein on the lateral part of the upper limb and the basilic vein on the medial part of the upper limb. Then we have some two minor veins that tend to either interconnect the cephalic to the basilic vein or tend to give collateral supply or collateral drainage to these other two veins. And this includes the median antebrachial vein of the forearm and then the median antecubital vein at the cubital fossa. Let's start with the dorsal venous network. As I said before, this is a network of superficial veins that is found particularly on the hand. They are found when the dorsal metacarpal veins of the fingers connect together. And we tend to find this dorsal venous network at the dorsum of the hand. Hence the reason why it's called the dorsal venous network. From the dorsal venous network, we have the next set of superficial veins originating from, and these are the cephalic vein and the basilic vein. They tend to originate proximally as a continuation of the dorsal venous network. Continuing with the cephalic vein, the cephalic vein is one of the major veins of the upper limb. It's a superficial vein that would originate from the lateral side of the dorsal venous network. So in terms of origin, the key word here is the lateral side. This is in contrast to what we see for the basilic vein that tends to originate at the medial side of the dorsal venous network. Once it originates from the lateral side of the dorsal venous network, it begins to ascend towards the forearm and it lies entirely subcutaneously until it gets to a particular point around the shoulder where it would become deep. So the cephalic vein, after originating at the lateral part of the dorsal venous network, would ascend onto the lateral border of the wrist first. Then from the wrist, it ascends towards the forearm. At the forearm is found on the anterolateral border of the forearm. I'll show you a picture of how it looks like. Once it gets to the junction between the arm and the forearm, what we call the cubital fossa, it tends to form a bend, and this bend is a bend that occurs at the elbow towards the posterior part of the arm. At the cubital fossa, the cephalic vein tends to be connected with its counterpart, which is the basilic vein. And this connection is made possible by one of the veins we'll talk about later on, the median cubital vein. So we say that at the cubital fossa, the median cubital vein would connect the cephalic vein to the basilic vein. Blood from the cephalic vein will be drained to the basilic vein through the median cubital vein at the cubital fossa, and that is very important to note. After this, the cephalic vein will continue to ascend along the lateral side of the arm. So it ascends to the anterolateral part of the arm and it runs towards the shoulder. At the shoulder, it gets to the lateral border of the arm, moving into the shoulder, where it would run along a particular groove called the deltopectoral groove. Through this groove, this is where the termination of cephalic vein tends to occur. I'll talk about that in the next slide. At the deltopectoral groove, the cephalic vein will terminate first of all by piercing through the clavipectoral fascia. It's a fascia that tends to cover that groove. So the clavipectoral fascia is kind of a boundary between subcutaneous part of the skin and the deeper muscle compartment. So once cephalic vein pierces through the clavipectoral fascia, we say it has become a deep vein automatically. Remember that it is not superficial throughout its course. It is only superficial up to the point in which it gets to the clavipectoral fascia. Once it pierces through the clavipectoral fascia, it becomes deep. And once it becomes deep, it terminates by draining into the axillary vein. And this is how the cephalic vein tends to end. It terminates by draining into it just blends with the axillary vein, and then all the venous blood carried by the cephalic vein would enter into the axillary vein. So using this image to explain the course of the cephalic vein, remember that cephalic vein starts from the lateral part of the dorsal venous network. We can't really see the dorsal venous network in this image because we're looking at the palmar part of the arm, not the dorsal of the arm. From the lateral part of the dorsal venous network, the cephalic vein would ascend towards the anterolateral part of the arm. As you can see, this is the anterolateral, right, compared to the anteromedial part of the arm, which is where the basilic vein will be found. Once it ascends through the anterolateral part of the arm and it gets to the cubital fossa, at the cubital fossa, it forms a bend towards the elbow. But what more importantly, at the cubital fossa, we have a connection between the cephalic vein on the lateral side and the basilic vein on the medial side, and that connection is made possible by the median cubital vein. After the connection is made, cephalic vein will continue to ascend towards the anterolateral part of the arm and run towards the shoulder. At the shoulder, it enters through the deltopectoral groove first of all before piercing through the clavipectoral fascia. In this image, you can see how the cephalic vein becomes deep at the clavipectoral fascia, which is found somewhere around this region. The second most important superficial vein of the upper limb is the basilic vein. Contrast to what we have in the cephalic vein, the basilic vein tends to originate also from the dorsal venous network, but from the medial side of the dorsal venous network of the hand. After it takes its origin from the medial side of the dorsal venous network, the basilic vein will start to ascend towards the forearm. So it travels up the base of the forearm, and in terms of its course, it tends to ascend posterior-medially. And as it's ascending posterior-medially, it ascends through the forearm to get to the arm. Remember that when it gets to the junction between the arm and the forearm, there's also a connection that occurs between the basilic vein and the cephalic vein. We talked about that when talking about the cephalic vein. But as the basilic vein ascends towards the forearm and gets to the cubital fossa, it will connect with the cephalic vein through the median cubital vein. After this connection is made, the basilic vein will keep ascending towards the arm. It tends to ascend at that posterior medial part of the arm that I mentioned initially. Once it gets to the middle of the arm, the junction between the middle and the distal third of the arm, that's when the basilic vein will become deep, and that's usually the starting point of its termination. So how exactly does the basilic vein terminate? It terminates at the junction between the middle and the distal part of the arm. At that point, the basilic vein becomes deep by piercing through the brachial fascia. Remember that for cephalic vein, it becomes deep by piercing through the clavipectoral fascia around the shoulder region, around the deltopectoral triangle. In terms of the basidic vein terminates halfway up the arm, junction between the middle and distal part of the arm, and it terminates by becoming deep, piercing through the brachial fascia. Once it enters into the uh, deep compartment of the arm, around that region, it would end by joining the brachial vein. So the basidic vein joins the brachial vein to give rise to the axillary vein. This is contrast to what we see for cephalic. Remember that cephalic vein, once it pierces through the clavipectoral fascia and enters into the deeper compartment of the shoulder, how the cephalic vein terminates is by joining the axillary vein. In the case of basidic vein, it doesn't join the axillary vein. It joins the brachial vein to form the axillary vein. So it always forms the axillary vein. And that's what we see in terms of the basidic vein and its termination. This is the picture that depicts for us the course of the basidic vein, starting from the medial part of the dorsal venous network. We can't really see that because we are being shown the palmar part of the hand and not the dorsum. So once it originates from that medial portion of the dorsal venous network, it ascends posterior-medially and eventually emerges at the cubital fossa. At the cubital fossa, remember that the basidic vein will be connected to the cephalic vein through a smaller vein called the median cubital vein. And eventually, from that point on, the basidic vein will ascend towards the middle of the arm. So at the junction between the middle of the arm and the distal part of the arm, the basidic vein will pierce through the brachial fascia and become deep, and thereby terminates by joining the brachial vein to form the axillary vein. Let's talk about the smaller veins. First is the median antebrachial vein, or what we call the median vein of the forearm. Now, this vein is highly variable and it's not commonly seen in every individual. It tends to be absent most of the time. It's a vein that tends to begin at the base of the dorsum of the thumb. So we say it arises very close to the palmar venous network, not the dorsal venous network in this case. So it arises very close to the base of the dorsum of the thumb, and it curves around the lateral side of the wrist before it ascends in the middle of the anterior aspect of the forearm, and that's where it tends to be located the most. Because it's called the median antebrachial vein, so it's going to be found largely at the forearm, but particularly in the anterior portion or the middle part of the anterior aspect of the forearm. I'll show you a picture of how it looks like. This vein is found in between the cephalic and basidic. So if you are tracing the cephalic and tracing the basidic, just in between them, in some individuals, you might eventually come across the median antecubital vein. Now, this vein has variable termination point. It can decide to join the basidic vein in the cubital fossa. That's one way. Sometimes it can divide into three. It can divide into an intermediate vein, a cephalic vein, and a basidic vein. And each of those smaller veins that it forms will now drain further into the basidic and the main cephalic vein, respectively. These are ways in which the median antebrachial vein can terminate. One other way in which it can terminate is by the fact that sometimes it replaces the median cubital vein when it is located in the anterior aspect of the elbow. So most times when we are seeing the median antebrachial vein, it might be a replacement for the median cubital vein. But in other cases, when we see the median cubital vein, we might as well not see the median antebrachial vein, or we might see both of them occurring together. So it's either or. So we can see just the median antebrachial vein. In that case, it has replaced the median cubital. We can see both the median antebrachial and the median cubital vein, or we can just see the median cubital vein. Remember that it's a very variable vein. We don't really see it in all cases. The last vein to talk about under the structural veins of the forearm is the median cubital vein. Now, this vein is a vein that is very commonly seen at the cubital fossa, hence the name. It's a vein that arises from the cephalic vein and drains into the basidic vein. Please always remember that it's starting from the cephalic and ending at the basidic. So it drains blood from the cephalic to the basidic. So as a result, this vein tends to run obliquely because of the relationship between the cephalic and basidic are not necessarily aligned. It passes medially across the cubital fossa and it tends to lie superficial to the bicipital aponeurosis. So it's just directly above the bicipital aponeurosis and the cubital fossa, we would access the median cubital vein. One very key thing to remember about the median cubital vein is that it is the site of venipuncture for anyone that wants to take blood or give injection at the cubital fossa. The vein that you should be targeting should be the median cubital vein. This is the image showing us the median cubital vein at the cubital fossa. You can see this vein that runs obliquely upward, starting from the cephalic vein laterally and ending at the basidic vein medially. and it drains blood from the cephalic to basilic vein. All right, this picture shows a live image of the veins that we just talked about. So to recap all the superficial veins of the upper limb, we have the cephalic vein. Cephalic vein in this image is starting all the way from the lateral part of the wrist and extending all the way up towards the arm. So you can see the cephalic vein as I'm tracing it throughout the anterolateral part of the arm and the forearm. Then we have the basilic vein as well. Basilic vein is found more towards the medial part of the upper limb, so it's found in the medial part of the forearm, as you can see, and also extends all the way up to the medial part of the arm, all the way up to the middle of the arm. So at the middle of the arm, we have the basilic vein terminating, so it ends somewhere here. You can also see some of the other veins. You can see the median vein of the forearm, what we call the median antebrachial vein. And this is the median antebrachial vein here. That's it, the vein in between the cephalic and the basilic vein. And I said it's a variable vein. Sometimes you see it together with the median cubital. Sometimes it replaces the median cubital. Sometimes we tend to see just the median cubital alone. In this individual, we have both the median cubital vein and the medial antebrachial vein present there. So in this variability, this is just one variation that we can see. And also in this individual, we can see the median cubital vein terminating into the basilic vein. So this is just its termination point to the basilic vein. Finally, we have the median cubital vein that will connect the basilic to the cephalic. You can see the median cubital vein here, connecting the basilic vein to the cephalic vein. And that vein is typically found at the cubital fossa. Moving on to the deep veins of the upper limb. These veins are veins that are found within the deep fascial compartment. They are found beneath the skin, but covered by deep fascia and found just close to muscles. One very unique thing about the deep veins of the upper limb is the fact that they tend to accompany arteries, and as a result, they tend to they call the same name as the arteries that they accompany. We tend to give a unique name to the deep veins. We call them vena comitans, just because of the fact that they tend to accompany arteries within the deeper compartment of the upper limb. Let's talk about the deep veins of the upper limb. The major deep veins you should know about will be deep veins of the fingers and the hands, the deep veins of the forearm and the arm, and then the axillary vein within the axilla. So most of these veins tend to have similar names to the arteries. So for example, the deep veins of the fingers and hand will be referred to as the digital veins. That's the one for the fingers, and maybe the palmar veins or the dorsal veins. That's veins present within the hand. For the veins of the forearm, we have the radial vein and the ulnar vein, which will mirror what we see for the arteries, the ulnar artery and the radial artery. And then the vein of the arm is going to be referred to as the brachial vein, since it's going to be accompanying the brachial artery of the arm. Then the axillary vein tends to just be called axillary vein because it's a very unique vein found within the axilla. As I said before, the deep veins of the fingers and hands are veins found within those regions, and they tend to accompany the arteries there. So they are pairs of veins that follow the course of the dorsal and palmar arteries of the fingers and hand. For the deep veins of the forearm, this includes the radial vein, the ulnar vein, and the brachial vein. Brachial vein being the vein for the arm, and then the ulnar and radial vein being the vein for the forearm. And these are veins that would accompany the arteries found in this location. So the radial vein and ulnar vein will accompany arteries found within the forearm. So they are accompanying the radial artery and the ulnar artery respectively, whereas the brachial vein will be accompanying the arteries found within the arm, which is the brachial artery in this case. The radial veins tend to receive dorsal metacarpal veins. This is just talking about how it tends to form. Dorsal metacarpal veins will eventually give rise to the radial vein, whereas the ulnar vein receives tributaries from the deep palmar venous arc. Brachial vein, on the other hand, is formed when there's a union between the radial vein and the ulnar vein. So, in terms of tracing their origin and eventually termination, radial vein is going to be gotten from dorsal veins within the hand. Ulnar vein is gotten from palmar veins within the hand, and then the two of them at the cubital fossa will fuse together to give rise to the brachial vein. Finally, the brachial vein will terminate by joining the basilic vein. Remember, we talked about that when talking about the superficial veins of the upper limb. So, brachial vein terminates by joining the basilic vein to form the axillary vein, and that's how we get to the axillary vein. The axillary vein is the last deep vein of the upper limb. This is the vein that tends to originate when the brachial vein unites together with the basilic vein. The site of this union tends to occur at the lower border of the teres major. This rings a bell. Remember that when we're talking about the termination of the axillary artery, we mentioned the fact that the axillary artery tends to terminate at the lower border of the teres major muscle. This point of termination for the axillary artery is the same point of origin for the axillary vein. The arteries and the vein tend to run in opposite directions. So wherever the arteries will stop is when the veins will be starting, and vice versa. In terms of the course of the axillary vein, it has a similar course to the axillary artery. Remember, it accompanies the artery as it runs beneath the axilla. But what you need to remember the most is the fact that the axillary vein tends to be found medial to the axillary artery. And this is very important, especially when there's an injury to the axilla. In the case of a puncture wound to the axilla, the likely artery to the likely vessel to be damaged is the axillary vein and not the artery, because the axillary vein is closer to the superficial part of the axilla, it's closer to the medial side compared to the axillary artery. And this is very important to know. One more thing to know is the fact that when the arm is abducted fully, the axillary vein tends to lie anterior and superior to the axillary artery. And this is just a change in course in terms of influences from change in the position of the arm. So in normal position, the axillary vein tends to be medial to the axillary artery, but in an abducted position, axillary vein tends to lie anterior and superior to the axillary artery. And this is just one extra thing you must remember. So how does the axillary vein terminate? It terminates by continuing as the subclavian vein at the inferior margin of the first rib, at the lateral border of the first rib. Remember that this same border is this same site is the site where we have the origin of the axillary artery. So where the axillary artery originates from, which is the lateral border or inferior border of the first rib, that same point is the site of termination of the axillary vein. Remember that the arteries and the vein tend to run in opposite directions. Talking about the tributaries of the axillary vein, which are branches, these are veins that tend to drain into the axillary vein. We have the cephalic vein. Remember, the cephalic vein would terminate by entering or joining the axillary vein. Then we have the brachial and the basilic vein. These are veins that will form the axillary vein, so they are tributaries. Their venous blood will be draining into the axillary vein. One more venous structure that drains into the axillary vein is the thoracoepigastric vein, and it's not really a vein that is important for you to note for upper limb. It's more of a vein we see in lower limb and thorax. This image that shows for us everything we talked about in a nutshell with regards to the upper limb and venous drainage, starting with the venous arches. We can see some of the deep veins present in this image alongside the superficial veins. We can see the basilic vein, median cubital vein, we can see the median antebrachial vein, the cephalic vein. So we can also see some palmar arches, a deep palmar arch, superficial venous palmar arch, and then the palmar dictal vein. These are all deep veins. You can also see the axillary vein in this image. You can see how the basilic vein and the brachial vein, not really shown here, would unite together to form the axillary vein. And then we can see how the cephalic vein would terminate by entering into the axillary vein, and then the axillary vein will eventually become the subclavian vein. So this is just showing us in a nutshell all the venous supply or venous drainage of the upper limb that we talked about initially. Talking about some clinical significance to the venous drainage of the upper limb, the two important clinical significance you should remember is in the concept of venipuncture and intravenous injection. This is an image of the venipuncture being done. Venipuncture is just the process of obtaining blood samples from an individual, and we tend to make use of venous blood in performing some laboratory investigations. So to obtain venous blood, we would need to access veins. One of the sites we commonly use in accessing veins is at the cubital fossa, and the particular vein that we are targeting is the superficial vein called median cubital vein. That vein that we talked about that joins the cephalic vein to the basilic vein tends to be the commonest site to performing a venipuncture, as you can see in this particular image. The last clinical significance for this particular topic is the concept of intravenous injection. So for you to inject in drugs or give medications to patients, one of the possible sites is through intravenous injection, and we can either give a cannula or inject it directly through the veins when giving a drug to a patient, as is shown on this particular part of the slide. And that concludes our module on the venous drainage of the upper limb.